Joe and Susan McCarthy loved their daughter totally and unconditionally. They would do anything for her. So, when Christine was paralysed in a car accident, they were left distraught and desperate. Doctors had said she would never walk again, but the McCarthys were not willing to accept that. They felt they had to search for any treatment available to make their child's life better.
I don't really remember much from the accident. I just remember waking up in a hospital bed in lots of pain with my mum and dad laying next to me, really, really upset.
Just the thought of her not being able to walk was dreadful. The thought of her, missing out on things that we all take for granted, I suppose, And after all the doctors were saying she's never going to walk, we decided to check, the internet. Someone told us about stem cell science, and we just thought, it gave us a bit of hope, actually. We thought maybe the answer is out there. It's just a case of finding the money, really.
Through internet research, the McCarthys became aware of various stem cell treatments being offered around the world. In 2008, when Christine was 11 years old, they decided to travel to Panama, where a clinic was promising a cure by injecting stem cells into Christine's spine.
And we looked at all the clinical websites and, they seemed professional, so, we decided to meet up with the reps in England, the representatives in England, and went from there, really.
They didn't say much, they just said that there was an operation and I could get on an aeroplane and it could maybe make me better, but I wasn't sure what it was doing.
Couldn't believe it, could we?
No.
We felt like we'd really, found the answer.
Like a miracle cure.
Yeah, absolutely.
Yeah.
We did, didn't we?
Yeah.
Unfortunately, the family's journey to Panama proved unsuccessful. The injection of stem cells into Christine's body didn't work, and her condition stayed the same as before. The family was left with a hefty medical bill, no miracle cure, and a feeling of regret.
We saw no improvement whatsoever. Looking back, with hindsight, it was just pointless. It was a fruitless, expensive waste of time and money, really.
The internet is congested with websites boldly claiming to cure debilitating conditions through stem cell treatment. But the reality is that many of the treatments are untested and the companies go unregulated.
So spinal cord injury and paralysis is an incredibly emotive topic, and anyone who's been involved in an accident where they've lost the use of their limbs is in an incredibly desperate situation. There are currently no treatments available to restore function or restore feeling. And stem cell tourism preys on that desperation and that feeling of helplessness by offering hope to those people, by offering them a treatment. And everyone's heard of stem cells and their potential. And while there is a lot of research ongoing into treating spinal cord injuries, using stem cells, using embryonic stem cells and adult stem cells, there is still a long, long way to go. But what these companies do is they prey on that vulnerability and that desperation.
The McCarthys used a website called StemCure, a company founded and fronted by Dr. David Fielsend. Dr. Fielsend was a practicing UK doctor, but now only offers treatments in an overseas clinic. He describes himself as a world-leading expert in regenerative medicine, and his clinic offers stem cell therapies for hundreds of diseases. Posing as a fellow doctor interested in buying stem cells, we convinced Dr. Fielsend to meet at a Manchester hotel.
How was your journey?
Oh, it was great. I just travelled up from Cheshire, so...
Oh, very nice, through Cheshire.
Can we order some coffee yet?
Yeah, I think she'll be along in a minute.
Okay.
Now, Mr. Fielsend, I've actually brought...
It's Dr. Fielsend. I'm the chief clinician for StemCure. I'm a medic qualified.
Sorry.
It's okay.
Dr. Fielsend.
It's fine.
I know that you think I'm here to buy stem cells, but that's not the case.
Oh.
I'm actually a reporter and we're making a programme about stem cells and you're being filmed.
Okay, that's rather a surprise.
Now, I'm here to discuss the treatment that you've been offering in Panama to UK citizens.
Right.
What exactly is it that you do?
We treat debilitating conditions with stem cells to improve patients' conditions.
And how does it work?
And you explain this to somebody who doesn't really know.
I've done quite a bit of research, Dr. Fielsend.
I'm sure you have, and if you'd come about it in the correct way and gone through the office, this would have made life much easier. But let me explain it anyway, and I'll try and break it down for you. We inject stem cells directly into the spine in your back the spinal column, and also into the blood system, and those stem cells then work their way to the damaged tissue and help to aid recovery. Do you understand?
Yeah, I'm quite familiar with the practice. Why have you never conducted any clinical trials?
If you'd done any sort of research, then you'd realise, and you know, that clinical trials take years. Incredibly time-consuming and incredibly expensive.
It's time-consuming, but it is the normal practice to go through. Now, you say that you can cure cerebral palsy, deafness, multiple sclerosis and paralysis. In fact, on your website, you list hundreds of conditions. Do you honestly believe that that's true?
Yes, I do.
You believe that it's
Yes.
true, that you can cure
Yes.
all these conditions?
Yes.
Dr. Fielsen, I think you're lying. What about Christine McCarthy?
You can't possibly be expected to remember every single case that we treat. If you look at the website, you'll see we treat hundreds of cases.
Okay, I will remind you. Christine McCarthy was a young paralysed girl from Manchester. She travelled out to your clinic in Panama and was injected by stem cells. And you charged her £25,000 for the stem cell
Need to check
treatment.
with the office, but probably.
Yeah. Your treatment and your practice is undermining the good work of scientists who go through the correct channels and do clinical trials. You also told the family that this treatment would be successful.
No. What I said was
You
that.
promised the family.
Well, no. What I said was that in most cases we see positive results. We don't offer guarantees to our treatment. We couldn't and we wouldn't offer guarantees to our treatment. That's ridiculous.
Are
Don't
any of
agree.
your treatments licensed?
Not
Well,
specifically
that-
licensed?
Not specifically, that answers my question then.
No.
I mean, I believe
Not
that this
listening.
treatment
Not listening.
will be successful one day, but right now it's not, and you're charging people £25,000. I say that this is a money-making scheme, that there's no proof,
I don't know.
there isn't a
That's
cure.
It, that's it. Right,
I
you
mean,
know
do
what?
you honestly
I'm done.
think that
I
this
am
is
done with this
ethical?
stupid
Do you
pantomime.
honestly
And
think
you,
this is
you know
ethical?
you,
Why are you
clueless,
raising your voice?
absolutely pointless.
Why are you raising your voice?
For God's sake, we help people. Do you understand that? Help
Dr.
people.
Fielsen, I suggest
Sit
you
there,
stop shouting.
patronising me.
People
Get out of the
money.
way.
Do you
No.
have anything to say
You're
to
ridiculous,
the
little girl.
family?
You're a child.
What
Grow
do
up.
you say to Christine?
It's the real world.
Dr. Fielsend is still using untested methods and taking people's money. Patients are not given proper information when they're offered his treatments. When we wrote to Dr. Fielsend to ask further questions, he refused to comment.
In my opinion, the people who are doing this are purely after money. They may have some misguided belief that what they're doing actually works now. They may have huge belief in the potential of stem cells. We all have huge belief in the potential of stem cells, but they don't see the need to follow the regulations that are in place in the UK or around the world.
I think it's just manipulation, really. Manipulation of, people that are not very well, and they know that they're preying on people that are, I suppose, vulnerable, because, when you care about your children, you'll do anything. You'll go to desperate measures, you'll do anything.
The future of stem cell science is incredibly exciting. There is huge potential for stem cells to cure all sorts of diseases, to restore function, to replace damaged organs, damaged tissues, and to give people their lives back, give people their quality of life back. But that can only be done by ensuring that they're safe and that they work. And you can't cut corners when you do that. You can't offer a treatment that hasn't been tested and that hasn't been proven to be safe. You have to go through those processes.
I think that treatments like these just make it even harder for families to deal with tragedies that they're going through. They're being preyed on.
When it's your child, if it was his child, that's what angers you. It's different. There's no way he'd do it to his own child, would he? But he's done it to ours.
It wasn't just a hard time for me, it was a hard time for all of my family, including my mum and dad. But that was then, you have to get over things, don't you?
They duped us, they kicked us while we were down, and our little girl more importantly. And it's disgusting.